Leg swelling is a signal your body cannot afford to ignore, yet millions of seniors accept those heavy, tight, and painful legs as just a normal part of getting older. That puffiness is not just uncomfortable, it's a warning sign from your circulatory system, and if you let it go unchecked, it can lead to serious problems like painful ulcers, reduced mobility, and even an increased risk of blood clots. But what if I told you there is an incredibly simple, 8-minute daily ritual, something you can do right now from your favorite chair that acts like a second heart for your legs, gently flushing out that stagnant fluid and bringing back the lightness and freedom you deserve? Forget expensive compression socks and endless doctor visits for a moment. Today, we are going to dive deep into exactly why your legs swell and, most importantly, I will walk you through the precise, doctor-approved, 8-minute routine that seniors must do daily to say goodbye to swelling for good. Get ready to finally feel your shoes fit comfortably again. Hello, I am Dr. Sandra Serrati, and for over 20 years I have specialized in helping seniors reclaim their health and vitality by focusing on the root causes of age-related discomfort. I have seen firsthand how much misery and worry something as common as chronic leg swelling, medically called edema, can cause, and I am here to tell you that there is hope and a proven path to relief. We are not just going to cover a quick fix. We are going to empower you with the knowledge of why this happens and a simple, repeatable action plan. So why does this happen to us as we age? Think of your circulation system like the plumbing in your house. Your arteries are the pipes bringing fresh water in, powered by the main pump, your heart. But the veins, particularly the ones in your lower legs, are the drainage system responsible for carrying the used water back up to the pump. In your youth, the tiny valves inside your leg veins, acting like one-way doors, are strong and snap shut perfectly to prevent blood and fluid from falling backward due to gravity. But as the years pass, especially after 60, these valves can become stiff, weaker, or even damaged. This is called venous insufficiency. Instead of a smooth, upward flow, the fluid starts to pool or leak out of the vessels and into the surrounding tissues of your feet, ankles, and lower legs. It is not just blood, it is lymph fluid, full of waste products. Your body is struggling to defy gravity, and when the plumbing backs up, the result is that telltale puffiness. It is important to know that simple weakness, not just disease, is the primary culprit, and weakness can be fixed. Most seniors do not know this next part, that this sluggish circulation is also a major reason behind that chronic fatigue many feel. When your blood is not moving efficiently, your tissues are not getting the oxygen they need, and you feel constantly run down. The core fix for chronic leg swelling is to manually assist that failing drainage system, and the best way to do that is through a specific, gentle, rhythmic massage. This is not a deep tissue, painful sports massage. It is a form of lymphatic and venous drainage that acts as that external pump your legs are missing. Here is the 8-minute step-by-step spoken guide you need to follow every single day, ideally in the morning or just before bed. First, the first minute is the drain opener. You must start high, near the groin. This is where major lymph nodes, the body's drain filters, are located. Gently, using the flat of your hand, make small circular motions just beneath your hip crease and inner thigh. Do this for a minute, feeling your skin warm slightly. You are opening the exit pathway. Next, minutes 2-4 are the calf flush. Move down to your ankle and calf. You are now going to use 2 hands, one slightly overlapping the other, and start at your ankle. With firm but comfortable pressure, stroke upwards toward your knee. It is essential that every stroke goes only one way, toward the heart. Think of yourself as a squeegee pushing water up a pane of glass. Spend 2 minutes on each leg, covering the whole back and sides of the calf. This action is physically squeezing the veins and lymph vessels, helping those lazy valves get the fluid moving back up. Following that, minutes 5-6 are the ankle and foot sweep. The puffiness is always worst around the bony parts of the ankle and the top of the foot. Use your thumbs to gently trace small circles around the ankle bone. Then, starting from the toes, use your fingers to scoop and stroke the fluid from the top of your foot up toward your ankle. A common mistake here is pressing too hard on the foot, which can actually trap the fluid. Be light and sweeping. Finally, minutes 7-8 are the grand finale and hold. Return to the calf. This time, do a full, long sweep from the ankle all the way to the back of the knee and then up toward the groin, maintaining pressure for the entire stroke. After the last stroke on each leg, lie back and elevate your feet on a few pillows for just 2 minutes. This combination of manual action followed by gravity assistance is unbelievably powerful. This is how you reboot your drainage. The reason this works inside the body is simple. The pressure on the skin and underlying tissue literally provides the mechanical force to push the fluid past those failing venous valves and into the lymphatic system, where it can be properly processed and drained. Stay with me. The next solution is even better for tackling the inflammation that makes the swelling feel so painful. While the massage addresses the mechanical backup, we must address the internal environment that contributes to it, and that involves targeted nutritional support. Swelling, or edema, is often linked to chronic low-grade inflammation and nutrient deficiencies that weaken blood vessel walls. Think about the power of magnesium and potassium. When you have swelling, your doctor will often ask you to reduce your salt intake, which is wise, but equally important is boosting your intake of the minerals that counter sodium, potassium, and magnesium. Potassium helps your body balance fluids and regulate blood pressure. Great sources are sweet potatoes, spinach, bananas, and avocados. Magnesium is vital for relaxing the muscle walls of your blood vessels, improving blood flow, and reducing cramps, which often accompany swelling. I recommend incorporating foods like pumpkin seeds, dark leafy greens, and almonds. Next, consider rutin and horse chestnut. These two compounds are legendary in natural health for venous support. Rutin is a bioflavonoid found in citrus peels, buckwheat, and asparagus. It works by strengthening the walls of the capillaries and veins, making them less prone to leaking fluid into the tissues. Horse chestnut extract, specifically the active compound aisine, has been clinically shown to reduce fluid leakage and significantly decrease the feeling of heaviness and pain in the legs. You can find both as concentrated supplements. And remember that hydration is key. This sounds counterintuitive, but drinking enough clean water is essential. When you are dehydrated, your body holds on to sodium, which worsens swelling. Proper hydration helps your kidneys flush out excess sodium and waste. My nutritional summary is this. We are not just eating for energy. We are eating to reinforce the structure of our veins. Focus on foods rich in antioxidants like berries and leafy greens to fight inflammation, and make sure your mineral balance, especially potassium and magnesium, is prioritized. This combined nutritional strategy ensures you are strengthening the system from the inside, while the massage fixes the mechanical backup from the outside. That is how you create lasting relief. Beyond the massage and your diet, there are several simple lifestyle adjustments that can drastically reduce the occurrence of leg swelling. These are often overlooked because they seem too basic, but their cumulative effect is profound. The first is to move every hour. The single greatest enemy of healthy circulation is prolonged sitting or standing. When your calf muscles contract, they squeeze the deep veins in your legs, acting as a second pump for your heart, which is why it is often called the skeletal muscle pump. If you are sitting for a long period, set a timer. Every 60 minutes, get up and walk for 2 to 3 minutes or do 20 calf raises right where you are. This simple act of muscle contraction is essential. Be sure to check your shoes. High heels and shoes that are too tight restrict the natural movement of the foot and ankle, hindering the calf pump mechanism. Opt for comfortable, supportive, low-heeled footwear that allows your foot to flex naturally with every step. Try a cold water rinse. At the end of your shower, spend 30 seconds directing a stream of cool or cold water over your lower legs. The shock of the cold causes the blood vessels to constrict and then rapidly dilate. This quick action improves vascular tone and helps to reduce inflammation and the sluggish pooling of fluid. It is a mini workout for your veins. Also, use gentle stretching. Simple ankle rotations and toe wiggles are a great way to keep the fluid moving, especially when sitting. Write the letters of the alphabet with your foot in the air. This seemingly trivial movement engages the small muscles and keeps the ankle joint mobilized, preventing fluid from settling. The goal here is not an intense workout, but consistent, gentle movement. These secondary solutions are the constant daily support that prevents the swelling from reaching a crisis point in the first place. Now, I want to pivot to a related problem that almost always goes hand in hand with chronic leg swelling and poor circulation: nerve pain and numbness, or what is often diagnosed as peripheral neuropathy. When blood flow is restricted, your nerves, which are essentially electrical cables, are starved of the oxygen and nutrients they need to transmit signals properly. This results in the tingling, burning, or cold numbness you feel in your feet and lower legs. The great news is that the very same techniques we are using for swelling are also powerful fixes for nerve health. The gentle massage routine is crucial here, but for neuropathy, we need to emphasize something called nerve gliding exercises. This is a very specific type of stretching designed to gently move the nerves through the tunnels they travel in to prevent them from getting stuck or compressed, which often happens in swollen tissues. Try the seated nerve glider. Sit on the edge of a chair. Slowly straighten one knee as much as you can, lifting your foot off the floor, while simultaneously tilting your head to the opposite side. Hold for a moment, then lower your leg and bring your head back to center. Alternate sides, doing this 10 times per leg. This action lengthens the sciatic nerve gently, improving its mobility and reducing the static that results in pain and numbness. Also, remember the importance of B vitamins. For nerve health, B vitamins, particularly B6 and B12, are non-negotiable. They are essential for nerve transmission and for repairing the myelin sheath, the protective coating around your nerves. If you are experiencing tingling and numbness, a high-quality B-complex supplement that includes active forms of these vitamins can make a dramatic difference. Poor circulation starves the nerve. The massage and gliding exercises open the pathways, and the B vitamins provide the necessary fuel and repair materials. Keep watching. The biggest mistake is coming soon, and it is something most people do immediately when they see swelling. We have covered the mechanical fix, the nutritional support, and the supportive movements. Now, let us look at 3 advanced yet incredibly simple strategies that supercharge your body's natural ability to manage fluid and circulation. The first is diaphragmatic breathing. The simple act of deep, slow, mindful breathing, also known as belly breathing, is one of the most underrated circulatory boosters. When you breathe deeply, the descent of your diaphragm creates a change in pressure in your chest cavity. This pressure difference acts like a subtle suction force, helping to draw blood and lymph fluid upwards from your abdomen and legs toward the heart. It is literally a natural internal pump. Practice 10 slow, deep breaths before your massage routine and 10 after. Focus on making your belly rise on the inhale and fall on the exhale. The next is the power of alternating temperatures. We already mentioned the cold rinse, but if you have access to a bathtub, alternating between a few minutes of warm water and a minute of cool water immersion for your feet and lower legs is a powerful vascular exercise. The warm water expands your vessels, the cool water contracts them. This rapid change significantly improves the elasticity and responsiveness of your blood vessels, leading to better long-term fluid regulation. Do this for about 10 minutes, always ending on cool. And finally, use specific postural fixes. Pay attention to how you sit. Crossing your legs, sitting on a low, soft couch that causes your knees to be higher than your hips, or leaning heavily to one side all restrict the flow through the largest veins in your pelvis and upper legs. When sitting, aim to have your hips slightly higher than your knees, keep your feet flat on the floor, and, if possible, do those gentle ankle rotations. These advanced fixes require only awareness, not equipment, and provide a huge boost to your system. Here are the critical, everyday mistakes that seniors often make that unintentionally sabotage their efforts to reduce leg swelling. Fixing these 3 errors is as important as the 8-minute massage itself. Mistake 1 is immediately reaching for a diuretic. Many people assume swelling means too much fluid, so they reach for a diuretic pill, either prescription or over-the-counter, or they load up on natural diuretics like excessive amounts of green tea or coffee. Diuretics work by making your kidneys excrete more water and sodium. However, in many cases of age-related leg swelling caused by venous insufficiency, the problem is not too much fluid in the body, but fluid trapped in the legs. Diuretics can actually lead to dehydration in the rest of your body, making the blood thicker and harder for the heart to pump, which can sometimes worsen the root circulatory issue over time. Always address the mechanical problem first. Mistake 2 is wearing ill-fitting compression socks. Compression socks are fantastic, but they must be properly fitted and of the correct pressure grade. A sock that is too tight and rolls down at the top creates a severe tourniquet effect, completely cutting off circulation at that point and making the swelling worse below it. A sock that is too loose is useless. If you are wearing compression, make sure it is a graduated compression sock, meaning it is tightest at the ankle and gradually loosens as it goes up the leg. Put them on first thing in the morning before the swelling sets in. Mistake 3 is ignoring protein intake. As we age, we often reduce our protein intake, perhaps because of difficulty chewing or simple habit. Protein is absolutely critical for managing fluid balance. Proteins, specifically albumin, in your blood create an osmotic pressure that helps pull fluid out of the tissues and back into the vessels. Low protein levels mean that fluid is more likely to leak out and get trapped. If you are struggling with swelling, make sure every meal contains a high-quality source of lean protein. This is a dietary pillar that is often overlooked in the discussion of edema. I am saving the most impactful, science-backed boosters for last to give you that final edge against chronic swelling. To truly optimize your vascular health and ensure lasting relief from leg swelling, we can integrate a few science-backed compounds that act as powerful internal support for your blood vessels. These are your high-authority boosters. The first is pine bark extract, or pycnogenol. This is one of the most powerful natural compounds for circulation. It contains potent antioxidants called proanthocyanidins, which have been shown in multiple clinical trials to bind to collagen and elastin, protecting the structural integrity of your blood vessel walls. By strengthening the walls, it makes them significantly less permeable, meaning less fluid leaks out into the surrounding tissues. It improves microcirculation and has been shown to be effective in managing chronic venous insufficiency symptoms like heaviness, pain, and swelling. Another powerful pair is L-arginine and L-citrulline. These 2 amino acids are essential precursors to nitric oxide in the body. Nitric oxide is a powerful vasodilator, meaning it signals the smooth muscles in your blood vessel walls to relax and widen. Widened vessels mean less pressure and easier blood flow, which naturally reduces the backup that causes the swelling. Taking a combination of L-arginine and L-citrulline can significantly enhance your body's ability to keep those arteries and veins relaxed and open, reducing the workload on your heart and improving overall circulation to your lower limbs. Finally, consider alpha-lipoic acid, or ALA. While often discussed for nerve health, which we know is related, ALA is also a potent antioxidant that helps improve the function of the endothelial cells, the cells that line the inside of all your blood vessels. By keeping these cells healthy, you keep the vessel walls strong and flexible, which is critical for long-term reduction of swelling. These boosters are not required, but they are highly effective additions to your daily regimen, working at the cellular level to complement the mechanical drainage of the massage. Let us now put everything together into one smooth daily routine that makes saying goodbye to leg swelling simple and effective. Think of this as your new morning ritual for circulatory health. First, hydrate and supplement by starting your day with a large glass of water, ideally with a pinch of Celtic or pink salt, to support proper mineral balance, and take your vascular support supplements, such as rutin or pine bark extract, with your breakfast. Second, perform the 8-minute fix. Before you get dressed, sit down and perform the full 8-minute upward stroking massage routine, starting at the groin and sweeping up from the feet and ankles. Finish by lying with your legs elevated for 2 full minutes. Third, throughout the day, set your timer to get up and move, doing 20 calf raises or walking for 2 minutes every 60 minutes. Maintain proper posture while sitting, keeping your feet uncrossed and your hips slightly above your knees. Fourth, for dinner and post-dinner, ensure your final meal contains a good source of lean protein. Later in the evening, incorporate your seated nerve gliding exercises to keep the nerve pathways free and clear. Fifth, before bed, if you choose to use cold water therapy, end your shower with a 30-second cool rinse on your legs, or do the full alternating hot and cool foot soak. This comprehensive plan addresses the mechanical, nutritional, and structural causes of swelling simultaneously, offering you the best chance at lasting relief and a return to comfortable, light-feeling legs. Please understand that your body has an amazing capacity to heal and improve regardless of the number on your birth certificate. That feeling of heavy, swollen legs is not a life sentence. It is a communication from your body, and today you have learned exactly how to respond. By simply dedicating 8 minutes a day to that life-changing massage and integrating these small, smart lifestyle changes, you are not just treating a symptom. You are fundamentally improving the health of your entire circulatory system. You deserve to walk with comfort, to travel without pain, and to enjoy your golden years without the distraction of aching, swollen limbs. Reclaiming that lightness and mobility is entirely possible, and the journey begins right now, today. Never give up on the potential for improvement. If this deep dive into senior health has provided you with hope and a clear plan, please take a moment to give this video a like and let me know in the comments if you plan to start the 8-minute massage routine tonight. Your feedback helps me reach more seniors who need this vital information. And if you are not already subscribed, hit that subscribe button so you do not miss the next health topic that could change your life.